All right, let's dive right into our first topic, understanding the definition and causes of bronchitis. Bronchitis is a respiratory condition that involves inflammation of the bronchial tubes. These tubes are responsible for carrying air to and from your lungs, so you can see why any issue with them could cause some discomfort. But what exactly causes bronchitis? Well, there are a few different factors that can lead to this inflammation. The most common cause is a viral infection, such as the common cold or the flu. When your body is fighting off these infections, it can sometimes lead to inflammation in the bronchial tubes as a side effect. Other causes of bronchitis can include exposure to irritants, like smoke, air pollution, or chemicals. In some cases, bacterial infections can also lead to bronchitis, although this is less common than viral causes. It's important to recognize that bronchitis can affect anyone, regardless of age or overall health. However, certain factors can increase your risk, such as having a weakened immune system, being a smoker, or having a history of lung diseases like asthma or COPD. So, in a nutshell, bronchitis is an inflammation of the bronchial tubes often caused by viral infections. But other factors like irritants and bacterial infections can also play a role. Now that we have a better understanding of what bronchitis is and its causes, let's discuss the two types of bronchitis: acute bronchitis and chronic bronchitis. Knowing the difference between these two forms of bronchitis is essential for proper diagnosis and treatment. First up, we have acute bronchitis. This type is a short-term illness that typically lasts for a few weeks. It's most commonly caused by a viral infection, like the common cold or flu. Acute bronchitis can be quite uncomfortable, but the good news is that it usually resolves on its own, without any lasting damage to the lungs. On the other hand, we have chronic bronchitis, which is a long-term condition. This form of bronchitis is often associated with smoking or prolonged exposure to irritants like air pollution or chemical fumes. Unlike acute bronchitis, chronic bronchitis doesn't go away on its own. In fact, it can lead to lasting damage to the lungs and significantly impact a person's quality of life. The key difference between these two types of bronchitis lies in their duration and causes. Acute bronchitis is a short-term condition, usually caused by a viral infection, while chronic bronchitis is a long-term issue, often related to smoking or exposure to irritants. It's crucial to know which type of bronchitis you're dealing with to ensure that you receive the appropriate care and treatment. Moving on to our next topic, let's discuss the symptoms of bronchitis. Recognizing these symptoms is important for timely diagnosis and treatment, so pay close attention to what your body might be telling you. The most common and noticeable symptom of bronchitis is a persistent cough. This cough can be dry, or it might produce mucus, which can be clear, yellow, or green in color. Mucus production is actually your body's way of trying to clear the infection and inflammation from your bronchial tubes. Another symptom to watch out for is shortness of breath. You might find it harder to catch your breath, especially when doing physical activities or exerting yourself. This happens because the inflammation in your bronchial tubes can restrict airflow and make it more difficult for air to pass through. Wheezing is also a common symptom of bronchitis. You might hear a high-pitched whistling sound when you breathe, particularly when exhaling. This occurs due to the narrowing of your airways caused by inflammation. Chest discomfort is another symptom you might experience. This can manifest as tightness, pressure, or pain in your chest, often caused by the persistent coughing and inflammation of the bronchial tubes. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional for a proper diagnosis and treatment plan. Remember, early intervention can make a significant difference in managing bronchitis and preventing potential complications. Now that we know the symptoms of bronchitis, let's discuss the various treatment options available for managing this condition. It's important to remember that treatment will depend on the type of bronchitis you have, acute or chronic, and the severity of your symptoms. For acute bronchitis, treatment often focuses on relieving symptoms and supporting the body as it fights off the viral infection. Over-the-counter medications like pain relievers, fever reducers, and cough suppressants can help alleviate some of the discomfort. It's also crucial to stay well hydrated and get plenty of rest to help your body recover. In some cases, your healthcare provider may prescribe medications to manage bronchitis symptoms. Bronchodilators, for example, can help relax and open the airways, making it easier to breathe. Anti-inflammatory drugs can help reduce inflammation in the bronchial tubes and provide relief from symptoms like wheezing and shortness of breath. For chronic bronchitis, treatment will involve managing the condition long-term and addressing the underlying causes such as smoking or exposure to irritants. Quitting smoking is a crucial step in managing chronic bronchitis, as it helps reduce inflammation in the airways and prevents further damage to the lungs. In addition to medications and lifestyle changes, your healthcare provider may also recommend pulmonary rehabilitation, a program that includes exercise, education, and support to help improve lung function. This can be particularly beneficial for those with chronic bronchitis or other lung-related conditions. In summary, managing bronchitis involves a combination of medications, lifestyle changes, and ongoing care, depending on the type and severity of the condition. It's essential to work closely with your healthcare provider to develop a treatment plan tailored to your specific needs. Finally, let's talk about preventive measures that can help reduce the risk of bronchitis. Prevention is always better than treatment, so taking proactive steps can make a huge difference in keeping your lungs healthy and avoiding bronchitis altogether. One of the most effective ways to prevent bronchitis is by getting vaccinated against common respiratory infections, such as the flu and pneumonia. These vaccines can help protect you from the viral infections that often lead to acute bronchitis, and they're especially important for individuals who are at higher risk, like young children, older adults, and those with weakened immune systems. Practicing good hygiene is another essential preventive measure. Washing your hands regularly, using hand sanitizer when soap and water aren't available, and avoiding close contact with people who are sick can help prevent the spread of respiratory infections that can cause bronchitis. Maintaining a healthy lifestyle is crucial in boosting your immune system and reducing the risk of bronchitis. A well-balanced diet, regular exercise, and adequate sleep can all help keep your immune system strong and better equipped to fight off infections. If you're a smoker, quitting smoking is one of the most important steps you can take to prevent chronic bronchitis and improve your overall lung health. Additionally, try to avoid exposure to irritants and pollutants like secondhand smoke, air pollution, and harsh chemicals, as they can contribute to bronchial inflammation and increase the risk of bronchitis. In conclusion, taking preventative measures, such as getting vaccinated, practicing good hygiene, and maintaining a healthy lifestyle, can significantly reduce your risk of developing bronchitis. Remember, taking care of your lungs and overall health is the best way to prevent respiratory issues like bronchitis.